Hi, okay. Ngayon, pag-usapan naman natin isa na naman, HMO, ang value care. Okay, let's get on with the business. Okay, okay, wait lang. Okay, ayun. Ano ba tong value care na to? Okay, so, tignan natin kung ano pa talaga siya. Okay, so, ito, value care um, is one business na accredited din sa mga lahat ng top hospitals except Asian Hospital. Okay, so ito. Membership eligibility, so pwede kang mag-enroll as long as you are for principal member as 18 years old to 62 years old and 11 months old and 30 days. So yun yung principal member. And the minor enrollee naman, pwede siya ng 45 days old up to 17 days old. Okay, so ito yung mga plans niya sa VIP. Open private, 200,000. Regular private, 150,000. Semi-private, 120,000. Semi-private also 90,000 per illness per member per year. And yung ward nila is 60,000 coverage per member per year. Okay? Hmm. So the principal member and the dependent can enroll with or without access to the top major hospitals. Okay, so yung basic coverage niya ito, pre-existing conditions, no, dreaded and non-dreaded. First year, pag-private rooms nasa 10%. Second year, private rooms nasa 50%. Aggregate limit, pag-ward naman nasa 40% MBL. So the third year, private rooms nasa 100% MBL. 70% naman if related on the kidneys or gallstone, and 80% naman sa ward, aggregate limit, and 50% sa kidney or gallstone. Then on the fourth year and the succeeding years, sa private rooms, up to MBL naman siya na per illness per benefit per year. So for example, may diabetes ka, then may hypertension ka din. So, per member, per year yan on the fourth year. First to third year is only aggregate limit. Hindi yun lang yung coverage mo sa buong sickness. So, yun yun. Yun yung difference nun. And sa ward, 100% MBL, 70% on the kidney and gallstone. Okay? So, congenital conditions, except physical therapy sessions and developmental disorders. So up to 10,000 per year aggregate limit siya. No, no, that the physical therapy sessions shall form part of the physical therapy or occupational therapy limits. So, okay. So ordinary illness or onset illness coverage up to MBL, allergy testing covered up to 1,500 per member per year, tuberculin test coverage up to 600 pesos per member per year, scoliosis, and including necessary procedures, except physical therapy sessions, whether congenital pre-existing or developmental or acquired, covered up to 15,000 aggregate limit per member, and limit for outpatient and inpatient siya. So both na siya for 15,000. For the necessary procedures for scoliosis. Then for chronic dermatosis, consultations only for outpatient and inpatient. Then electric cauterization of the skin lesions, just such as wart, filiform warts, and molluscum contagiosism in any part of the body prescribed by an affiliated physician is up to 1,000 per member per year siya. Scleotherapy for varicose veins up to 3,000 per leg per member per year. Pag COVID-19, covered subject to PhilHealth and DOH guidelines. Pag monkeypox, covered subject to MBL, excluding tecovirimat. So, pag work-related, consultations only, yung covered pag work-related siya. Pag motor vehicular accident, covered up to MBL subject to evaluation, police report, and deed of subrogation required. So may forms na isa-sign yung client para ma-cover ng Valucare yung treatment. Okay? So items including in standard exclusions and limitations are not covered unless provided by Valucare Corporate HMO Program. So, ito yung benefits niya. For the preventive care, pag passive and active vaccines for treatment of tetanus and animal bites, including administration fees, but excluding ARPs, is up to 10,000 pesos. Immunization is covered also except the cost of vaccines. Periodic monitoring and management of health problems, covered din siya. Counseling on family planning, covered siya. Health education on diet and exercise, covered. Medical history record keeping is covered also. And scabies, consultation in accredited clinics only. Then for our annual physical exam, all members are entitled to the following AP procedures per year and scheduled by Valucare to accredited provider. So, physician statement, chest x-ray, CBC analysis, fecalysis, ECG for members 35 above, and pap smear also for members 35 years old and above. Okay? So the AP can only be availed upon the full payment of the membership fees and pag semi-annual naman on the 6th month. Okay? So after the effective date of the agreement. So ano naman sa outpatient? Outpatient, any number of necessary consultations and treatment during regular clinic hours, excluding the prescribed medications. So, prenatal and postnatal consultations with Valucare accredited obstetrician, procedures and medications that are related to maternity are excluded. and also covered is up to 10 consultations, subject to the MBL alert. So referrals to accredited specialists when necessary, diagnostic subject to MBL, diagnostic X-ray laboratory examinations and diagnostic procedures required and prescribed by the accredited physicians subject to MBL. Okay, then the ENT care and treatment prescribed by the accredited physicians is also subject to MBL. So inpatient care coverage per member is pag room and board based on the member's plan at any Valucare accredited hospitals covered siya. Then professional fees covered subject to MBL. Medicines and injectables subject to MBL. Then blood transfusion subject to MBL. The use of operating rooms, intense ICU coronary care unit, and neurocritical care unit as required is subject to MBL also. Standard nursing services subject to MBL. Inhalation and nebulization therapy subject to MBL. Oxygen and the materials needed to facilitate its administration subject to MBL. Dressing and sutures and conventional cast subject to MBL. All other items related are directly related to the management of the patient as deemed medically necessary by the attending physician. It's also subject to MBL. So, ito naman sa emergency care coverage per member. So, doctor and hospital services subject to MBL, medicines used for immediate relief and treatment of symptoms subject to MBL, oxygen and the materials needed to facilitate its administration, blood transfusion, blood typing, cross matching, subject to MBL, dressing sutures and conventional cast, subject to MBL, diagnostic X-ray laboratory exams, diagnostic and therapeutic procedures related to cases subject to MBL, voluntary room upgrade to the next higher category except suite room if members to non-board category is not available during emergency admission is covered for the first 24 hours, subject to MBL also. So, emergency care services in non-accredited hospitals is reimbursable up to 25,000 per emergency case, but not to exceed members MBL. Na members MBL is 100% of the professional fees based on what it would have cost Valucare. Okay, and also pag emergency cases in areas without accredited hospitals or medical facilities is reimbursable up to MBL. Okay? So medical procedures and modalities per member, whether inpatient or outpatient, pag mga 24-hour Holter monitoring is subject to MBL, 2D echo with Doppler subject to MBL. Adrenocortical function test is covered up to 5,000. Angiography, including the MRE, is 10,000. So angioplasty is 50% of the MBL as long as it's medically necessary. And arthroscopic procedure covered up to 10,000. 10,000 pesos siya. Okay. Yeah, covered up to 10,000. Audiogram and Kiphanogram, subject to MBL. Bone mineral density measure or DEXA scan is covered up to MBL. Brachytherapy is up to 10,000 pesos. Brainstem auditory evoked response is up to 5,000 pesos. Cataract surgery, including the lens, is covered up to the PEC limit. So, covered siya up to the PEC limit. Pag mga cataract surgery. So, sa chemotherapy naman, covered siya up to 6 sessions. So, sa cryosurgery, covered up to 1,000 pesos per area. Then sa CT scan, covered up to MBL. Sa CT stonogram, covered siya up to 10,000 pesos. Then sa dialysis, covered siya up to 6 sessions. Then sa EEG, covered up to MBL. Sa electromyography, covered up to MBL. Sa eye laser therapy, except for correction of EOR, covered up to 10,000 pesos per eye per year. Okay, sa hemiography is covered up to MBL. Stop hysteroscopy procedure is 20,000 pesos. Inhalation therapy is 20,000. Inhalation therapy is covered up to MBL. The laparoscopic procedures covered up to 30,000 pesos. So the laryngeal stroboscopy is covered up to MBL. The ESWL covered up to 20,000 pesos. The lung function studies covered up to MBL. The echocardiogram covered up to MBL. The mammography covered up to MBL. So the MRI, including the magnetic resonance spectroscopy, is 5,000. So myelogram is covered up to MBL. The nuclear radioactive scan covered up to MBL. Open heart surgery covered up to 50% of MBL. Orthopedic surgery is covered up to 30,000, except arthroscopy and the cost of implant or prosthesis. So, yun. Other machine-guided procedure covered up to 10,000 pesos. Outpatient physical therapy or occupational therapies, 10 sessions. Percutaneous is covered up to 35,000 pesos. Percutaneous ultrasonic is covered up to 35,000 pesos. Plasma urinary cortisol is covered up to MBL. Prostate surgery like TURP is covered up to MBL. Radioactive iodine therapy for hyperthyroidism covered up to MBL. Radiotherapy is 6 sessions. Sleep study is covered up to 5,000 pesos. Speech therapy for non-congenital disorders like stroke is covered up to 7 sessions. Pag stereostatic brain surgery is covered on up to 50,000 or 50% of MBL. Then the transurethral microwave therapy is covered up to 10,000 pesos. Treadmill test is covered up to MPL. Ultrasound, except maternity related, covered up to MBL. Ultrasound guided procedures covered up to MBL. So all new and sophisticated diagnostic modalities or treatments for which there are no comparable conventional or traditional equivalent or counterpart parts is 5,000 pesos. Okay, so meron din to dental benefits. Dental benefit include any number of consultations with an accredited dentist, treatment of dental related pain, excluding the cost of medicines, simple oral prophylaxis once a year, simple tooth extractions, gum treatment, jacket in the athlete. So temporary fillings, annual dental examinations, adjustment of dentures, relief and prescriptions for acute dental pain, emergency desensitization of hypersensitivity, orthodontic consultation, aesthetic dental consultation also. Okay, so take note that the dental services can be availed with prior appointment with an accredited dentist. So medicines prescribed by the dentist are not covered and for the account of the member. Okay, if meron din to financial assistance increase. So meron siyang basic group life insurance of 50,000 pesos, accidental death also of 50,000 pesos, loss of life of 100,000 of the insurance amount, loss of entire sight of both eyes, loss of both hands and feet, 100,000, loss of one hand and 1/4, 100,000, by 100% rather. Loss of one hand and 1/4, 100%. Then loss of either hand or foot and sight of one eye, it's 100%. Then loss of either hand or foot or sight of one eye, it's 50% of that 50,000. Okay, so yun. So, okay, so yun. So these are the fees, membership fees. So if ever you're around, okay, if ever you wanted to avail of the services ng Valucare, just give me a message. I'll put my link down below. Also, okay, aside from this, meron tayong additional enrollee fee of 250 per principal. Okay, one time lang naman to. And 150 per dependent. So, anong mga requirements? So, first is the application form and the valid ID. Tapos sa mga minor enrollee naman, application form with principal signature or guardian signature, then birth certificate of the child. Okay? So, yun lang. So, ito yung mga exclusions and limitations. So if ever you wanted to avail this, just send me a message or just chat me up and I will send this to you. Okay? So yun lang. So if ever you wanted to avail of any of our HMO plans, don't hesitate to message me. Till next time, bye. Ciao.